Hi, I'm Michael Marchant. I'm the Director for Health Information Exchange at UC Davis in Sacramento. We were the first site that had the community spread COVID patient. So I had the CNN parked in front of our hospital for 3 days, which was interesting. But I've been personally working in the health technology space on the provider side since the mid 90s, implementing systems, integrating systems from clinical to business to operational systems. I'm also very plugged into the TEFCA and 21st Century Cure Act. So part of what my personal interest in self-sovereign identity and consent management really centers around the ability for patients to control access to their data, be able to put together a longitudinal health record. Today, the reliance for data exchange and interoperability is really on the health provider side. And really what I think that the blockchain technology can do is enable patients to control their longitudinal record and be able to, again, create use cases that don't exist today and don't run through Apple or Google. So they have control, they have the ability to provide consent and manage that data and put together a longitudinal record. And I think that's at least from my perspective, a real impressive use case that blockchain or a problem that blockchain seems to be able to solve that the traditional healthcare interoperability hasn't solved. So that's really my interest in being a mentor, is that I have a lot of experience. I know in the inside and outside of hospitals and hospital systems and how EHR or other vendors think, how their data is stored and how to get access to it. We're working internally on creating some mechanisms for patients to actually, we connected with HealthKit and we're trying to make, to respond to 21st Century Cures is to make data available via API to patients separate from our EHR. So we have a lot of initiatives that are about interoperability. And I just see this as part of that. So, but looking forward to mentoring and partnering and just engaging with this group, and happy to field questions.